Good afternoon and welcome everyone. My name is Audrey Schott and I work with the Montana Rural Health Initiative. The mission of the RHI is to engage partners to share ideas and expertise and to support communities in improving health while stimulating a higher level of wellness across the state. Thank you all for joining us today for our webinar, Healthy by Design, presented by Heather Fink. Heather began work as the Community Health Improvement Coordinator in September 2013. She is supported by the 3 Alliance organizations with an office at Riverstone Health. Heather has a master's in integrated corporate communications from the School of Journalism at Drake University in Des Moines, Iowa, and a Bachelor of Arts in Public Relations and Religion from Wartburg College in Waverly, Iowa. For approximately 17 years, Heather has worked in social and health services in the areas of public relations and communications, program management, consulting, administration, and most recently as a grant writer and manager for St. Vincent Healthcare Foundation in Billings. Before Heather gets started, I'd like to go over a few technical details with all of you. All of the lines have been set to mute. If at any point during our presentation today, feel free to unmute your line. To do this, all you need to do is press *6. We will have time for questions with our during the presentation today, and we would like to hold questions until the end. So again, if you would like to ask questions over the line, please feel free, unmute your line and ask away. Otherwise, you do have the option to submit questions via the question box, and we will answer those at the end as well. So without any further ado, I'm going to let Heather get started.
Thank you, Audrey. This is Heather Fink, and as Audrey mentioned, I am working on behalf of the Alliance, Billings Clinic, Riverstone Health, and St. Vincent Healthcare in Billings and Yellowstone County, and am speaking to you today from an office at Riverstone. I noticed that I think John Felton, our CEO, is on here, so no pressure there, but I did want to acknowledge both he and several of our existing collaborators and partners that I noticed registered for today's webinar, and just thank them for their contributions, and also mention that if there is additional content that they would like to contribute to, please jump in and offer some of that. As Audrey mentioned, I have been in my position 7 months, not quite, and so have much yet to learn, and am in awe of the work that has been done to date. And Audrey, I just want to confirm that everyone can see my screen.
So we can't see it yet, Heather. You should have a little box that has popped up somewhere on your screen that says you've now been made the presenter, and you just want to click share your screen. There you go.
All right, great.
Let's see. Hold on. You've got click through a slide or two and see if it comes back. There we go. Perfect. You are good to go, girl.
Thank you. So I would like to start by just acknowledging that this has been a journey and continues to be a journey in Yellowstone County, and that we will be covering a couple objectives today. First, just presenting a brief overview of the Alliance, and I'll give you a definition of that and its recent work. Also, providing some information on the current community health needs assessment been done in Yellowstone County, recently done, and community health improvement plan underway, and explain just a little bit about how those pieces inform the work of Healthy by Design. Also, just giving some more detail of what Healthy by Design's structure and efforts look like to date. So as Audrey mentioned, I work for Riverstone Health, St. Vincent Healthcare, and Billings Clinic, employed at Riverstone Health. As many of you are aware, St. Vincent Healthcare and Billings Clinic are highly competitive hospitals, but have chosen to also acknowledge the work that can be done together in the community, in addition to the collaboration with Riverstone Health as the public health entity, local county health department. So much of the work that's been done with these 3 entities as the Alliance is covered on this slide, just as I highlighted, but I wanted to just acknowledge that I'm only really digging into a few components of that today. So I wanted to just mention that there's various projects and efforts that have been executed in the past, including great work like the Community Crisis Center with other community partners, and kind of starting with some of the efforts like Cover the Uninsured Week. This is not to be meant to be overwhelming, but I did want to just, again, acknowledge the path that's been taken and the journey. And really, the Alliance has been working together for 20 years. This only goes back to 2000 and is no way exhaustive, but gives just an idea of some of the highlights of efforts that have occurred. The Alliance definitely is focused on things they can do together in the community to address the uninsured, underinsured, and underserved and benefit the community and population overall in the county. And as you see, there's been opportunities to have some pretty strategic efforts around different grant projects and different policies and different initiatives. As you look through these, you'll also notice that community health needs assessments have been a priority throughout, and we will mention more about that moving forward. So to begin things, I wanted to actually get a sense from those that are participating of the knowledge of community health needs assessments, because that is kind of the basis for our work. And there's a poll that Audrey is facilitating for us that you should have available to you. Audrey, do you want to jump in on that?
I've just opened the poll, and that should show up on each of your screens. And we will leave it open for about a minute. So select an answer that applies to you and give us some feedback.
Thank you, Audrey. So let's see if I can open this up to see responses. Great. So it's pretty obvious that quite a number of you have engaged with community health needs assessments, whether you're assisting with the development of them, the execution of it, or utilizing those for data. And I just wanted to make sure we were speaking common language with that. So definitely good to see the participation and utilization of those needs assessments in your counties. And just want to find out if I can, there we go. So if we look at the community health needs assessment that the Alliance has chosen to do, has been actually executed in collaboration for 3 cycles now. The first two cycles were done every 5 years, and the 3rd cycle that we just completed was done following the 2010-11, so actually in a 3-year increment. And that is based off of the need of hospitals via their IRS requirements and their Schedule H to respond to the IRS and their requirement of now an every 3-year cycle. Fortunately, Riverstone Health was willing to come on board and change their 5-year increment. It's also a requirement for public health accreditation to have a community health needs assessment, and it's definitely been a basis of the work of the Alliance, which sponsors each of those needs assessments. They utilize a consultant firm and have historically used professional research consultants for these 3 cycles. There are 3 components of the community health needs assessment. The first is the telephone survey that was conducted. The most recent required 404 Yellowstone County adults to respond via landline or cell phone to a questionnaire that took about 20 to 30 minutes, depending on if there were children in the home and length of answers, etc. Additional data that was collected via statistics, etc., and then also focus groups that were done in the county. You can see the list of the groups that were pulled together to collect information about the needs of our county. So some of the trends that I just wanted to mention that we've been able to now identify, because we have done 3 cycles and have been allowed the opportunity to use the same format and the same agency, the same consultants, to give us some baseline information. You can see some trends here, positive and negative. This does not necessarily mean that if it's a positive trend that it's at the level that we want it to be, or conversely, if it's a negative trend that we may be meeting Healthy People 2020 standards, but it just may be on the decline over the last 3 cycles. So a couple of modifiable health risks that we wanted to highlight that are related to the latest needs assessment results, which were conducted. The results were collaborated and conducted in 2013 and then announced in January 2014. So brand new results in this last cycle, and you can see a couple of the, bulleted results here. So you have everything from overweight obesity rate of 65.7% in our county, and you can see the vegetable consumption, fruit and vegetable consumption, and also the percentage of Yellowstone County residents who have cardiovascular disease risk. So related to our community health needs assessment, obviously, is our response to that. And here is a slide that just gives a really quick overview of our existing community health improvement plan. So the path that we've taken is that the community health needs assessment obviously informs the work, and so our community health improvement plan that is currently in existence is informed by our 2010-2011 needs assessment. And here are the goals that were identified related to the 3 priorities that were identified through a community process. So those include improve access to health care, improving health weight status, and improving mental health. You can see that there are related goals, and those goals were, we've set targets for those goals and been able to track those then over the 3 needs assessment cycles using questions that directly correlate and give a response in the community. So, for example, with increasing the percentage of people in Yellowstone County who have a healthy weight, we can see that according to our community health needs assessment results, the 2005 rate was at 35.8%, dipped down to 25.4 in 2011, and then back up in 2014 to 31.9%. The Healthy People 2020 goal related to that is 33.9%. And the goal that we set for 2014 was actually to maintain that 2011 rate of 25.4. So we exceeded our goal for 2014 and are hopefully on the way back up, and we are encouraged by that and hope that it will continue to increase in percentage. So as we look at our community health needs assessment supported by the Alliance and the community health improvement plan that gives the Alliance as well as the community a way to kind of gauge response and progress, we want to acknowledge the structure of how we've been doing work to date. And so the piece that I wanted to focus on today, and that perhaps many of you have heard of, is the Healthy by Design work. But I first wanted to kind of paint a little bit of a picture. So you can see here the Alliance partners at the top of this structure, and this Healthy by Design coalition that we will spend the majority of the rest of our time together kind of unpacking is a community coalition that not only includes those Alliance partners, but a variety of entities and individuals from throughout the community, and I will show you a slide that gives a little bit more information on that. And kind of the most recent piece added to this is the community health improvement piece, and it's a brand new piece and has afforded me and a part-time assistant the opportunity to focus not only in the area that Healthy by Design has been, but also in additional priority areas related to that community health improvement plan that I just highlighted. And as we move into our next community health improvement plan, which is now being authored related to our latest needs assessment results, we will see this structure grow and change and respond to the needs assessment and the CHIP as it's formulated. So under this Healthy by Design, you'll see these these 5 work groups, and those are all related to the healthy weight priority, and we'll unpack this a little bit. So first I wanted to highlight the Healthy by Design Coalition. As you can see, this gives a pretty good sense of the variety of partners that are engaged. And again, as I mentioned, the focus of this coalition has been historically physical activity, nutrition, healthy weight, and related work. And specifically, I want to highlight that these 5 work groups and that coalition have been really trying to move the needle in relationship to policy systems and environmental change. As Audrey mentioned, I came from St. Vincent Healthcare Foundation, and so I've had the opportunity to learn a little bit in my short time about public health and continue to grow in my knowledge of that. But for those of you in that arena, policy systems, environmental change is just second nature. It's, when it comes to that community mindset of making systemic change, it's kind of in your blood. But in the hospital world, I think this is definitely more of a path that needs to be traveled down, and we have to remind ourselves to move outside our 4 walls. So again, we will unpack these work groups, but I just wanted to kind of highlight that much of the focus of this work has been around policy systems and environmental change. So I first want to run through each of these work groups, and I'll start with the recognition program work group. And this was one of the first work groups to kind of come on the scene, as you may have noted with the timeline that I just briefly shared. The recognition work group is focused on acknowledging and assisting in planning events and conferences and meetings that are healthy by design. This work came out of some of the initial collaborative that was called Healthy Places, and that was a Robert Wood Johnson project that actually drove a conference and then drove some of this event recognition structure to create and educate, encourage, and recognize the efforts of those that are trying to put events and workshops and conferences together in our community. So here's the 5 standards of that work group. This is the qualifications that each need to meet under an application that they submit, and they receive support and promotional materials when these standards are met, and they are designated a Healthy by Design event. So some of those items may look like healthy menu options related to nutrition and related to physical activity, offering activity breaks, for example, during a day-long session. And then related to environmental stewardship, obviously offering recycling options as they are available. We have community experts that review each of these standards and provide feedback to the applicants and offer recommendations where needed to support that. The second work group that I wanted to mention was the Built Environment work group, and again, you may have seen this work group highlighted on that timeline. This slide just gives you a little bit of information, kind of a reminder of some of the choices that we've made in recent past, where you'll see that in 1969, 48% of all children walked or biked to school, and Conversely, in 2009, 13% of kids are walking or biking, and the picture on the right kind of paints that picture of a motorized society. So we're seeing less children biking or walking, missing out on that important, what they call incidental activity in the day, and the traffic congestion before and after school that happens. Also the decreased safety and perception of safety that comes from kind of today's practices. Along those same lines, we have some great pictures of kind of comparing what complete street looks like, and I'll give you a little bit more information on that. But if you'll notice the slide on the left, you can see that it's designed for automotive traffic. And then if you look at the picture on the right, you can see a little bit more of diverse user opportunities with the sidewalks and the bike lanes and the bus stop, etc. So this is a great flashback picture of downtown Billings that you can see has multi-users available and taking advantage. So everything from the pedestrians on the sidewalks to the motorist and the horseback rider and bicyclist and trolley on sharing the road. So many of the benefits of having a complete street is not only increasing physical activity and therefore affecting obesity, but also attracting people and revitalizing neighborhoods, attracting new development, even boosting property values and providing safer, less dangerous routes for all users. So there was a complete streets policy that was actually passed through some of the work that was conducted in Billings, and that was actually passed unanimously by City Council and was adopted August 22nd, 2011. And here you can see more of a definition of complete streets. So they're designed and operated to enable safe access for all users. And as you may have noted on our Healthy by Design collaborative, the coalition, many of the folks that are participating in that coalition have strong interest in this area. So, for example, we have Met Transit at the table for that coalition that has been a great partner in the work with the Complete Streets policy. The next work group that I want to mention is the Healthy Weight work group. This group has developed out of the Healthy Weight Collaborative that was, again, mentioned in some of the historical work that we've done. And one of the major highlights of this work group, along with some specific projects that they've been focused on, is the identification of a community message. And so that's what you see here on the right, is a message that we've been using for a little while now with community, everything from schools to gyms to we've even presented it at health enhancement teachers at a PIR day. We're utilizing it in our healthcare facilities, and wherever we can have our community embrace the message, we're encouraging that. So that message talks about 5 or more fruits and vegetables, 2 hours or less of screen time, 1 hour of physical activity, and 0 sugary drinks. And this gives you just a couple reminders of why that message is important. Some other work of the Healthy Weight work group actually is engaging with our school district and some of the folks that are looking at policy as well as nutrition in the schools. So our Billings Action for Healthy Kids group and our hopefully soon to be reinstated School Health Advisory Committee. I mentioned the Healthy Weight Collaborative project, and you'll see our community message at the bottom of this resource labeled Adult Prescription for Healthy Weight. The collaborative was formed out of was, I guess, funded by a grant, but its actions continue, and the collaborative actions were focused on measuring weight status at primary care visits and informing patients of their weight status and talking to patients about modifiable health risks. And there's definitely still work to be done. This resource in front of you is one that's available both in an adult format and a youth format that allows for providers to essentially prescribe a plan and give kind of those really quick statistics, and also develop a goal and remind folks of that community message and how that can support the goal that they are pursuing. One thing that we've found in the latest community health needs assessment was that we saw a pretty big jump in those that were hearing from their healthcare, their primary care provider about their need to look at their weight status. And so we were encouraged by that, but there, like I said, there's always work to be done. Another piece of this weight group is their focus on motivational interviewing, which they've been conducting primarily trainings in the clinical setting to help providers counsel patients and look at not only the weight that they are at or their BMI, but what may be influencing that decision to have some modifiable behaviors that continue to maybe go in a less than satisfactory path, and maybe their BMI is something that can be addressed. But what's all behind that? You know, is there opportunities for mental health support, etc. So that motivational interviewing, as I mentioned, has been kind of in that clinical setting, but is now looking at there's trainings that are now occurring, for example, in the YMCA, and may move to other locations throughout the community where it may be effective. The next work group that I'd like to mention is the Worksite Wellness work group, and this is again another opportunity to influence large portions of our population in our county, specifically looking at how we can support our workforce and our employers in policies and system changes within the work site that can promote better health. So a couple of the tools that we've made available through Healthy by Design are under this work group of Worksite Wellness, both a nutrition checklist, and then on the next slide you'll see a worksite physical activity checklist. And these resources are available on our website and are actually also used as part of an initial assessment that this work group can offer to Yellowstone County employers to look at where there may be opportunities for policy change or system change within their workplace. And these were developed utilizing the CDC Change tool in addition to some other national recommendations. So here's the physical activity checklist. And as I mentioned, there's obviously an opportunity to provide benefit not only to employers but to employees. So here's a few highlights of some of the benefits that an employer can see through some of these policies or systems, or even kind of cultural norms shifting. So obviously reduced employee absenteeism can be part of that. Employee productivity can go up. Recruitment and retention can be impacted, and creating that kind of culture of health. And here are some benefits to employees. Obviously, being able to impact their health status is a major benefit, and lowering healthcare costs to an employee and to an employer, and increasing job satisfaction and providing just an improved and more supportive work environment. So when it comes to bottom line, there's been research that's been conducted to support worksite wellness programs that are effectively implemented and we can look at a business case for worksite wellness related to return on investment that can also help in that promotion of change in systems and policy. So another work group that I would like to highlight is this health equity work group, and this is probably the most recent submission of a work group to the Healthy by Design structure. And their focus is on showing that economic, social, and environmental factors influence health. That seems pretty obvious, but to just kind of name that and develop some work around that was the intent. So we've said that a community that is healthy by design actively works to achieve the highest level of health possible for all groups. In our community health needs assessment, one thing that we've noted over and over is that income status is an impoverished folks within our county are definitely seeing lower health status overall as we look across all of our indicators and our questions. So one of the activities of this work group is a gardener's market, and this has historically been conducted at Riverstone Health. I believe this is the 4th year for the gardener's market under the Health Equity Work Group, and this will begin June 12th, and it will be held on Thursdays, and it's moving to South Park in Billings, which will allow for some shade and some potentially more community engagement. This gardener's market is obviously not only just creating another opportunity for access, but addressing a part of our community that has experienced a food desert designation. So the south side of Billings is in that category. Here's some information on the 2013 results of our gardener's market. So averaging about 50 customers each week and 5 sellers. So not a huge farmer's market that maybe some of you have experienced in your downtown areas, but definitely those that are interested in selling at very reasonable prices and are looking at produce primarily. And we're looking at local growers, obviously. So creating that pathway to access, in addition to not only having local producers there, but in addition to access this summer will be the opportunity to accept SNAP benefits, so formerly known as food stamps, and also I believe there will be acceptance of debit cards at the stands this year, which is kind of unique to Billings to have those options available for folks who will be attending the market. Another project of the Health Equity Work Group is a grant-funded project called Increasing Physical Activity for Women in Yellowstone County via a gender-based approach. Obviously, gender can be a barrier, but we also recognize it as an opportunity in relationship to physical activity. And here is a discussion, kind of a pictorial discussion of constraints and opportunities that have been identified via focus groups that were conducted in Yellowstone County related to gender-based constraints and opportunities related to physical activity. So some of the constraints that you can guess are named through these pictures were including things like caretaking roles and maybe hobbies that are less physically active, expectations around appearance and work schedules, and concerns with safety. So as you can see over on the opportunity side, there's opportunities around social support related to physical activity, feeling a responsibility to make sure the kids and maybe the dog are exercised and active, and also just the readily available recreation opportunities supported by some of the work that our Built Environment Work Group has done. So some of the work that the Health Equity Workgroup and specifically the grant project is focused on is creating opportunities for women to be more physically active and to have the opportunity to learn more about what that looks like for women in Yellowstone County. One of the responses to the constraints was to identify this active living everyday evidence-based curriculum that is being delivered throughout the county and is free to all residents. They're able to sign up and attend courses that are focused on addressing the barriers to physical activity and working on goal setting, creating pathways to activity that can be accomplished without a lot of those restraints of maybe money or location. In addition, kind of supporting this work is a response that we've seen to the lack of leisure time physical activity among women, which is one of our measures of the Community Health Improvement Plan, one of the measures on that plan. And so comparing the data from our 2010 assessment to our 2013-14 assessment, we did see a slight increase in those that reported a slight decrease in those that reported a lack of leisure time physical activity. So we saw some improvement. It wasn't great, but the real eye-opener around this is the discrepancy between women and men, and especially in the 2010 Community Health Improvement Plan, there was a 7% variance between women that were reporting no leisure time physical activity compared to men. Another piece of this campaign to increase physical activity in women is to offer public messaging. And so this is a campaign that, again, references our 5210 public message, as you'll note at the bottom of this flyer, and specifically highlights the 1 hour of physical activity, which is obviously the focus of this project related to women. And so this messaging is targeting women specifically, and also that 1 hour of physical activity. So here's a couple more of the messages around that public campaign. And there's not only materials that are available on our website and also via Facebook, but there are billboards and PSAs on radio and TV underway. We hope to sustain these messages beyond grant funding, and so try to develop those as tools that could be used beyond the grant cycle. And here's a link to our website. Many of the resources that we discussed are available, and I encourage folks that if they can't find those resources to definitely get in touch with us, and we can circle back and help them locate those. So as I mentioned at the onset, we are in a process of updating our Community Health Improvement Plan, and we anticipate that our work will grow. This is a highlight of some of the work that's been underway for the last few years and continues to be refined and developed and shaped. One of my counterparts recently talked about collaborative work and work of coalitions always changing and moving with the tides, and that's important to recognize that as more information is available and as our community changes and hopefully becomes healthier, there is new challenges to address and new opportunities to engage as a community in steps to make efforts moving forward. So I wanted to just acknowledge that Healthy by Design's mission is to collaborate with those partners across sectors of the community to promote and improve health. And one of the taglines that we're using is making the healthy choice the easy choice. And Many of you have probably heard that language if you've been around community health recently. I know that I'm done a little early, and that was kind of intentional because I thought there may be quite a bit of conversation. I would encourage some of that, and also just if there's folks, again, that are on the line that would like to contribute to either some of the questions that are posed or some of the content presented, I would definitely encourage that as well. Thank you, Audrey.
Thank you, Heather. That was great. So if there's anybody out there with questions, comments, to unmute your line again, please press *6 and fire away. Otherwise, feel free to submit questions to the chat box. Catherine and Tony, I see that you both have your hands raised. If you'd like to ask a question, you can ask it over the line, or if you click on the questions box on your GoToWebinar dashboard, you can type one in. Here we go. How did you get the buy-in from physicians, Heather, for this project?
I'm sorry, I missed what you said, Audrey.
So our first question is, how did you get buy-in from the physicians?
So I guess it depends on which portion of which project you're referring to, but obviously the strength of our work is the alliance. So having the 3 CEOs initially say, we want to work together, and that's where I would suggest that the buy-in per se came from, is that the CEOs had the foresight to say, we want to work together on community health improvement. And so that history of work and that leadership is really what has driven engagement. And that's, to acknowledge, of course, physician champions are always a challenge. But I think starting with leadership and really having that that buy-in from the top helps set the stage for expectations and engagement.
Great. All right. So we've got another question. What is the name of the Robert Wood Johnson Foundation initiative that you mentioned during the recognition work group?
So can I still work with my slides here? Is that okay?
Yep, absolutely.
I want to just flip back if I can to my, no, maybe not. There we go. Sorry, don't mean to send the screen running through. I just wanted to pull it up so that you can kind of see. And again, I need to just throw out the caveat that I wasn't in this work when this work was happening, and so there's definitely folks that are have more expertise on what was actually accomplished. But you can see here the Robert Wood Johnson grant that worked with the Healthy Places Initiative. And I'd have to get the specific information on the program. There may be somebody on the line that can very quickly rattle that off, but I honestly don't have that at the just at the top of my head. But I do want to mention that there is a current announcement through Robert Wood Johnson that is still funding health impact assessments, and so I have noted that that's come out recently as well, and so I would assume that it's along similar lines. Again, this was 2007, so it may have been something that was maybe packaged a little differently, but I would just throw that out if someone's looking for health impact assessment funding.
Sounds like that is the grant name they were looking for. Do we have any other questions out there for Heather? Well, it looks like we are going to end a little bit early today. Heather, thank you so much for being a presenter for an RHI webinar. It was a great presentation, and I hope that everyone was able to learn a lot. There was a lot of great information presented. So before you guys all take off for the afternoon, I just thank you again for joining us, and I hope that you'll sign in for the next RHI webinar that piques your interest. And just as a quick note, I will be sending out a survey, and I'm just looking for some feedback on this webinar and any other RHI webinars that you've attended. So watch your emails for a survey link, and if you've got some time, I'd love to have your feedback. And with that, we will wrap things up for the day. Thank you again, Heather, and thank you all for joining us.
Thank you, Audrey.